In this episode, we want to talk about finding doctors. You're going to obviously be dealing with a lot of doctors, so finding the right doctors is critically important to the care that the PALS is going to receive. First thing I would recommend is ask other PALS, ask other caregivers, who are they using and what do they think about that particular doctor. And references are very worthwhile. So go to an ALS support group, get on the phone and talk to other ALS caregivers and find out who the doctors are that they're using and get references that will help you determine who's best for you. The next thing you should think about is that you need local doctors. There was a very good ALS clinic about 75 miles from us. And at the time that my wife was diagnosed, I thought, well, since this is such a well-known ALS clinic, maybe we'll sign up with that clinic and use the doctors there. What you don't understand is very quickly a 75-mile drive, an hour and a half there and an hour and a half back, plus an hour at the clinic, is not something that is going to be easily done by you and the PALS. The PALS is not going to have the energy to be able to do something like that on a frequent basis. So you need local doctors. You need somebody that you can get to as easily as possible from a time standpoint and an energy standpoint. The most important doctor you're going to need is a neurologist. Critically important to the care that the PALS is going to receive. There's basically a couple of choices. Environments, if you will, that you can look at. One is a neurologist who's a patient neurologist, sees patients, or she sees patients 5 days a week. The other is a situation where the neurologist is in a research environment. They're in a hospital, in a teaching hospital, and they may see patients 1 day a week or one day every 2 weeks, but they're not seeing patients 5 days a week. There's a big difference between the kind of doctor support that you're going to get from a research doctor versus a patient-oriented doctor. So I would recommend, my recommendation would be to look for that patient-oriented neurologist rather than the research neurologist. You certainly can see the neurologist in a research environment for lots of other reasons, but for day-to-day care that you're going to need from a neurologist, I would recommend that you look for a patient-oriented neurologist, somebody that's had experience with ALS patients. You need a palliative care doctor, and so if at all possible in the geographic area that you're in, hopefully there is a doctor that specializes in palliative care, and you need to get signed up with them as quickly as possible. It's also extremely helpful for both the PALS and you to have a psychotherapist or a psychologist that can provide emotional support, and you need somebody who has, again, dealt with ALS or has dealt, if not with ALS, at least with patients who are terminally ill or have a terminal disease, not just somebody that's dealing with normal type emotional problems. Problems that they've got to deal with here are very different than that are just a general to run emotional problems. Very, very different. You need somebody that understands that. Watch out for situations where doctors who may be very well-meaning and certainly doing it for valid medical reasons are asking you to have the PALS get testing for things that are really extraneous or not really important for you at this point in time. The best example of this is very early in my wife's ALS treatment. A particular doctor suggested that she get some additional testing to see if there was a possibility that she had breast cancer. And a very good friend of mine who's a retired OBGYN asked me about that and said, is that really important at this point in time? Do you really want to go down that path? And after thinking about it, we decided, no, that isn't necessary. One of the people at the ALS user groups locally enjoys sitting out in the sun. And That's his enjoyment at this point in time. And the doctor told him, you can't sit out in the sun, you're going to get skin cancer. And he said, bring it on. So think about some of the medical advice you're getting in the context of dealing with ALS, and ask, do you really need to do those kinds of things? Are they really necessary? Same with a pulmonologist. Are there things that a pulmonologist can do for you, or are you spending time at a doctor's office and not really valid for the kind of care that you need? Again, these are decisions. I'm not providing medical advice here. That's an individual thing. I'm only suggesting that you think about it and say, do we really need to do these things? Because the PALS has very limited energy. And do you want to be going to doctor's appointments, getting the PAL up, getting them into a vehicle, driving them down to a hospital, getting them out of the car, getting them into the building, getting an appointment, and then getting them back home again, if the appointment really isn't going to do you any good? So just think about the value of it, and ask the doctor when you see them, is it worthwhile that we continue appointments with you? Most of the doctors that we dealt with were very frank about saying whether or not they thought continuing appointments was worthwhile or not.